The foundation for saving lives in cardiac arrest patients is high-quality basic life support. It's critical that you can successfully perform these skills because effective advanced cardiovascular life support depends on them. Welcome to the American Heart Association CPR and AED skills video. In this section, you will practice the elements of basic life support and then pass a test demonstrating that you can successfully integrate CPR with the use of an automated external defibrillator, or AED, into a single rescuer situation. These skills are essential to complete the ACLS case scenarios and testing. You will first watch while a rescuer here in the American Heart Association Training Lab demonstrates each skill. Then you will practice with the rescuer in the training lab. This technique of practicing while watching allows you to master the pacing and timing of compressions and breaths. For now, just watch the demonstration. The first skill we will practice is combining 30 compressions with 2 breaths. Remember to push hard, compressing at least 2 inches and allowing complete chest recoil between compressions. Make sure you position your body over the patient. It is also important to push fast by maintaining a pace of at least 100 compressions per minute. Your instructor will be timing your compression rate. Finally, minimize interruptions in chest compressions. This includes any pauses to deliver breaths or while the AED is charging. Next, you'll deliver 2 breaths, each lasting 1 second. Let's review how to correctly place the mask on the patient's face. Place the mask over the face using the bridge of the nose as a guide. This is best achieved by forming a C with the index finger and thumb of one hand on the top side of the mask at the bridge of the nose. This motion firmly secures the mask to the face. Place the thumb of your other hand along the lower border of the mask. Open the airway with a head tilt, chin lift. Lift the jaw and press the mask tightly to the face to make a seal. Then give 2 breaths, watching for chest rise. Now let's practice. You will complete 3 cycles of 30 compressions, followed by 2 breaths.
One, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 7, 8, 9, 30. One, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 4, 5, 6, 7, 8, 9, 30. One, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 4, 5, 6, 7, 8, 9, 30.
So, let's build on the skills we've observed and practiced. We will now illustrate a single rescuer BLS test here in the training lab, showing how to combine CPR and AED use. When you complete your test in a few minutes, you will need to perform these actions just like this healthcare provider. I will not be coaching or correcting you during the test. You should do whatever you would do in a real emergency to save the patient's life. For example, if you check the pulse on the mannequin and there is no pulse, you should do whatever you would do for a person who has no pulse. You must actually perform each step of the skill on the mannequin. Do not simply describe what you're doing. It is important to demonstrate the skills on the mannequin as you would perform them on an actual arrest. I'll tell you when to stop. You may begin when you're ready.
Hey, are you okay? Activate the emergency response system. Tell them he's unresponsive and not breathing, and get the AED. No pulse. Beginning compressions.
1, 2, 3, 5, 6, 7, 8, 9, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30. One, 2, 3, 4, 5, 6, 8, 9, 10.
Attach pads to patient's bare chest. Plug in pads connector. Analyzing heart rhythm. Do not touch the patient. Shock needed. Charging.
2, 4.
Stay clear of patient. Deliver shock now. Press the
Shocking on
flashing
1,
button now.
2, 3.
Shock
delivered. Resuming compressions.
Begin CPR. Start with compressions.
6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4.
Very good. You may stop now. Now it's your turn to complete the Single Rescuer test demonstrating CPR and the use of an AED. Your instructor won't tell you about the condition of the patient once you start, and your instructor won't answer any questions. You can treat your instructor or another student like a bystander and tell that person to do something that you would tell a bystander to do. If you make a mistake or forget to do something important, you should not stop. Just do your best to correct the error. Continue doing what you would do in an actual emergency until your instructor tells you to stop.